planned cesarean. So if you are in the process of receiving a planned cesarean, there's a few things that you want to know about the day of, just so you can prepare and plan and have an idea of what to expect. So the morning of your cesarean, they're going to have you come in early. They typically do that to ensure that they have enough wiggle room in case things occur that's going to cause your cesarean to be pushed back. So once you arrive, you will sign in at the nurse's station and they'll get you all set up in a room. A few different people are going to come through to speak with you. Typically the nurse and the anesthesiologist, as well as your physician, are going to come in to talk to you about the risks of the procedure, the risks of receiving an epidural, and you will have to sign a consent form saying that you acknowledge these risks and are proceeding with the surgery. Once you do sign this, you will receive IV fluids. There is a risk of your blood pressure dropping, so the IV fluids help to reduce that risk, and then your epidural or spinal will be placed. A catheter will be placed in your bladder to help with urination, and at that point, your support person or your partner is going to get scrubbed up. You will be sent to the OR while the individual stays behind. While you're there, they are going to prep you for surgery. There are a few things that they can do at that time. Your abdomen will be washed and possibly your hair will be shaved. They will also create a sterile field for the surgery. Once everything is prepped, they will go ahead and give your partner a call and let them know that they are welcome to come and join you in the OR. The surgery will be performed. The surgery is a lower abdomen surgery. It's a horizontal cut in most cases. You shouldn't feel any pain. If you do, let your doctor know immediately. But you can expect to feel a lot of pressure and a lot of tugging as they deliver your baby. Depending on your hospital, your provider, and kind of what's allowed and the birth plan that you've discussed, will depend on if the baby is taken to the warmer to be assessed right away, or if you're allowed to do skin-to-skin or breastfeeding in the OR. If you have any other preferences as well, such as clear drapes or music playing, things that might be important to you, these are all things that you want to speak with your provider beforehand, and remind them of that when you arrive to ensure that you have the scenery that is important to you. Once the baby is ready, then he or she is going to get passed off to your partner and will be held then. You'll get the opportunity to meet your baby, and at that point they're going to clean you up. So they will remove your placenta and get you all stitched up and ready to go, all cleaned up and ready to go to head to your recovery room. Once your surgery is complete, you will be sent to recovery. There, your blood pressure, pulse rate, respiration rate will be monitored over time, and you're going to be watched for bleeding and other potential complications. You're also going to be administered antibiotics at this time to reduce your risk of infection, and offered pain medication through your IV, so that way to help with the pain of the incision as your anesthetics wear off. At this time, again, you will have your baby with you, so if you wish to establish breastfeeding, this is a great time to do that. Your nurse will do a wonderful job of showing you how to breastfeed, especially with that incision site. It's going to be important to be cautious of that as you breastfeed your baby. And if you're not planning on breastfeeding, then this is an opportunity for you to bottle feed at that time. Once you are all set with recovery, one more thing that they actually do in recovery as well sometimes is they put these socks on you, these very tight socks, and they may put this tool that massages your legs to help reduce the risk of blood clots. So it just helps with the circulation of the blood in your legs to reduce the risk of that. Once you are done with recovery, then you're just going to go to your postpartum room. You will typically be in the hospital for about 3 to 4 days, again, just to monitor you, make sure that infection doesn't set in, that everything is healing properly, and once you get the green light, then you'll be able to head home with your baby.